Welcome to Body Solutions, where total physical fitness is directed by a physical therapist. Today I'm going to talk about what a tendinosis is. When you first injure a tendon and you inflame it, it's just good old healing process happening. Anything that you damage, the inflammation comes to the area. The inflammation has enzymes and things that were designed to break down and remove the dead tissue that you unfortunately destroyed during your injury. So when it removes those dead tissues, those inflammatory chemicals also bring in healing chemicals, sort of baby cells that come to the area and heal. And that's a normal healing process. However, if you continue to keep damaging that area, keep damaging, if I take a hammer and I hit my elbow, it gets bruised, it heals, it's fine. But if every week I keep hitting it and it just keeps bringing those inflammatory chemicals to the area for such a long time, typically more than 3 months, what ends up happening is those chemicals that are normally just using enzymes to break down the dead tissue to get rid of it, it's starting to use the enzymes to break down even the good tissue. So a tendinosis, unlike a tendinitis, which is we're dealing with inflammation, a tendinosis, we're really dealing with a tendon that's been sort of melted. Those enzymes start to degrade and break the chemical bonds that are holding your tendon together. And imagine a tendon that looks like Swiss cheese. Okay, there's no physical holes, but it's much broken down and it's weakened. And that treatment involves much more physical therapy, much more care, and a very different approach than a tendinitis. With a tendinitis, we do anti-inflammatory treatments, things with like ultrasound, we ice, we can even do heat, some light stretching, just kind of molding the healing process. With a tendinosis, we want to do eccentric, high resistance exercises. Meaning, for example, if I'm doing it for this muscle here, this muscle helps my wrist come up. So I would actually put a heavy weight in my hand and lower it down. So it's basically stretching the muscle as I'm resisting that motion. That's called the eccentric phase of resistance training. The reason is that type of force and that direction of force helps deposit more collagen, more tendon tissue in the tendon. We basically, at this point, we're not dealing with inflammation anymore. We're dealing with a tendon that's been broken down, and we need to apply mechanical stress through it to help rebuild that tendon. So if you've had some tendon pain that's been lasting for 3 to 4 months, I highly encourage you to come in for some treatment for us to assess, are we dealing still with a tendinitis or are we dealing with a tendinosis? And sometimes you might need an MRI to confirm that diagnosis. But typically we see people with chronic, 4, 5, 6 months of tendon pain. It typically will respond much better to a tendinosis protocol than a tendinitis. Okay, so I hope that answers your questions about tendinitis versus tendinosis. Again, if you have any questions, please contact us through email, phone, Facebook, YouTube. You'll find us somewhere.